ABG is very important because it can be done very quickly and it gives you a lot of results that are important and can lead you to an accurate diagnosis. In fact, most of the values that we see in the ABG or VBG can indicate serious conditions which often require immediate and serious treatment. The first and most important value of the VBG or ABG is of course the pH. The blood pH, or the acidity of the blood, should be between 7.35 till 7.45. Anything higher indicates alkalosis, and while alkalosis can be severe and can be dangerous sometimes, but it's not as bad as acidosis. If the pH is lower than 7.35, it indicates acidemia, and this is often the result of something serious. So check the patient's breathing, check the metabolic panel, and look for toxins or organs dysfunction. Next, we have the partial oxygen pressure, and this is essentially how much oxygen you have in your blood. Not oxygen associated with hemoglobin, but oxygen dissolved in the blood. And this should be from 75 till 100. If it is decreased less than 75, it can indicate problems in breathing. And next we have the partial pressure of carbon dioxide. And again, this indicates how much carbon dioxide you have in the blood. And this should be from 35 till 45. And this is again very important because it should be within this range. If it's higher than this range, it can cause acidemia, as carbon dioxide themselves are acidic. So if you have a pH indicating acidemia of the blood, check the partial pressure of carbon dioxide. If you find that it's elevated, this indicates respiratory acidosis. Next we have bicarbonate, and this again is very important and should be between 22 till 26. It's basically a highly alkaline product, and it balances the acidity of other products. So if it's elevated, it can cause alkalosis of the blood. Next we have the oxygen saturation, and it basically indicates how much of the hemoglobin is saturated with oxygen. It's almost exactly the same as the oxygen pulse meter of the hand. The ABG can indicate problems in breathing, so even if the patient seems that they're breathing fine, but you find that carbon dioxide is highly elevated and oxygen is decreased, this indicates problem in breathing. So it can diagnose some subclinical conditions. And like we said, it can also assess the acidemia and alkalosis of the blood, and it can give you an idea about the cause. If the bicarbs are high, this indicates metabolic cause. If carbon dioxide is high or low, this indicates respiratory cause. We also use it in cases of cardiac issues. If the patient is suspected to have sepsis or shock, it is very important in these cases because you have to have a baseline of the patient condition. And you can also monitor the response of treatment after you start the treatment for these patients. It's also used for post-operative patients, as it can also indicate some cardiac and cardiopulmonary function, and in trauma cases, especially if the ABG has lactate levels, as lactate increase in cases of abdominal trauma. This lecture is part of the emergency medicine course. If you find it useful, you can check out the entire course in the link in the description. The course covers everything that has to do with the emergency department, including tests, imaging studies, common cases, and serious conditions. We also have a lot of cases and quizzes that you can take to test your knowledge. Just check the link in the description.